we've talked about the phonatory anatomy and how the voice is produced at the level of the vocal cords, we have to figure out how we get that sound from the vocal cords and out to the mouth. That's done through resonation. So when we talk about resonation, we're talking about everything that vibrates above the level of the vocal cords as the sound bounces across all of those resonating cavities. All right, so what are the resonating cavities? Resonating cavities are just the structures of the throat, the oral cavity, and the nasal cavity that are formed by the muscles and the overlying mucosa that coats them so that sound can bounce out. So we have four primary resonating cavities. We have the larynx itself, and when we're talking about resonation, we're talking about everything above the level of the vocal cords for the larynx. We have the pharyngeal cavity, we have the oral cavity, and the nasal cavity. So there are two very important structures that we'll talk about in the resonating section, and that is the nasal side of the velum, so this primary section up here, not the oral side, which we'll talk about in the articulation section, and the pharynx. And when we talk about resonation with the pharynx, we're primarily talking about this top portion of the pharynx known as the nasopharynx. These two structures work together to close off the nasal cavity so that sound doesn't always come out of our nose, because it might sound something like this. Otherwise, as we're talking, these two muscles are going to close off so that sound comes through the oral cavity. So resonation is, again, that level of the vocal cord that the sound is being produced. That sound is going to bounce around the supraglottic larynx, through the pharynx, and out of the oral cavity, except during nasal sounds, and we'll talk about those nasal sounds later, when the velopharynx is open, and that's the velum and the pharynx are open to allow sound to pass through the nasal cavity. So again, this will relate it back to the picture that you're more familiar with. We have the vibration at the level of the vocal cords, the supraglottic larynx, and the sound bouncing around in those cavities. So how does that happen? We have muscles that we have to learn about, and we'll talk about them more in the resonating module. But for now, I want you to just kind of learn about them and the innervation of them, because we won't focus so much on the innervation once we get into that module. So if we're looking in the mouth, we're thinking about how we have a cavity here. We have the floor of the mouth that forms the floor of the oral cavity, and we have the roof of the mouth that forms the top of the oral cavity. And that sound bounces around on our cheeks, the top of our tongue, the roof of our mouth, and it shapes those sounds. And we have the velum here in the back, which is that soft, squishy portion. But we're not focused so much again on that soft, squishy portion on the oral side. We're focusing on the nasal side, because it's on the nasal side that we have muscles that bulge up to meet the back of the pharynx. So if we look in the mouth, this is what it looks like typically, but this is what it looks like when we have just our muscles instead of that mucosa laying over it. So we have a muscle here, we have a muscle that creates a sling in the back, and that muscle in the back is going to help raise up the velum on the nasal side to touch the back of the pharynx. So if we come over here, think about that picture that you saw just a moment ago that has just the cavity. These are the muscles that underlie the pharyngeal cavity. And it's divided into three sections. We have the superior muscle constrictors of the pharynx, we have the medial constrictors, and we have the inferior constrictors. And I'm not going to make you get that specific, but I'm just giving you some information so you can relate it back to how we're learning about this concept. So the superior constrictors are going to line up mostly with the nasopharynx. The medial constrictors are going to line up with the oropharynx, and the inferior constrictors line up with the hypopharynx. And then looking here, we have the maxilla, which gives us that roof of the mouth, or that shelf or plate of the nasal cavity. And so our muscles for the velum are going to sit back here in this area, and you can actually see this is one of the muscles here that you also see in this picture as the sling. And so the innervation for these muscles is primarily given by the vagus nerve, and that's efferent or motor innervation to help move these muscles to meet those pharyngeal constrictors. And then sensory information is provided by the glossopharyngeal nerve. So we have sensory information from the glossopharyngeal nerve, and we have motor information from the vagus nerve, except for one muscle of the velum, which is given by the trigeminal nerve. And then on this side, we have the pharyngeal constrictors that are primarily innervated by the hypoglossal nerve, with a little bit of motor innervation by the glossopharyngeal nerve. And then at the bottom of the pharynx, we have innervation by the vagus nerve, but we'll focus on that more in the swallowing section because for resonation, we're focused on the top portion of the pharynx, not the bottom portion of the pharynx. And then the sensory information is also provided by the glossopharyngeal nerve for the pharynx. And so the glossopharyngeal nerve helps for the sensation of the pharynx and the velum, so that you know, or the body knows, you don't really pay attention to it, the body knows that this muscle is closing all of the way to keep sounds from coming through the nasal cavity. It's also for when we feel things going through our nose. So if we feel like we have liquid going through our nose, we can feel that because of the glossopharyngeal nerve as it passes this nasal space of the nasopharynx and then the top of the velum.